Hi, my name is John, and I have the following detectives with me: Detective Chi, Detective Hack, Detective Genesis, and Detective Paul. And this is our concept map. I have Mrs. Yates. She's a 70-year-old African American with a history of heart failure. Just a little background about her. She was admitted to the hospital 2 months ago for heart failure and has been seen by a home care nurse every other week to assess her symptoms of heart failure. She is independent and active in her community. However, the nurse called the provider after assessing new onset signs and symptoms, which include edema in both lower extremities, recent weight gain of 10 pounds, shortness of breath, and increased oxygen demand when ambulating about 20 feet, oxygen saturation of 95% on room air, crackles, and then fatigue. Mrs. Yates denies any history of smoking, chest pain, radiated pain towards arm or jaw pain, nausea, and diaphoresis. She also reported no symptoms of back slash stomach pain, confusion, dizziness, and fainting. She has a history of hypertension, heart failure, coronary artery disease, MI, 5 years ago, and an ejection fraction of 55%. Her vital signs include temperature of 97.6, blood pressure 140/70, heart rate of 93, respiration 22, and then 0 out of 10 pain. Her current medication include aspirin, clopidogrel, lisinopril, and carvedilol. Pending lab draws CBC, BMP, BNP, troponin, creatinine, CKMB, and albumin. The physician has ordered EKG, chest X-ray, and EKG done at the outpatient setting for further evaluation, and PO furosemide to start the uricing. For the map key, we have the nursing diagnosis. The red line will be the confirmed relationship. The blue note will be the nursing interventions. The red one will be subjective, objective data. The green, goals, and then the purple one's collaborative interventions.
Hi, I'm Detective Paul. I'm a detective working on the case of Mrs. Yates, and my first nursing diagnosis is excess fluid volume. So here are some of the subjective and objective data. Mrs. Yates had a recent weight gain of 10 pounds. She had edema in both lower extremities. Her blood pressure was 140/70. She told us that she noticed that her legs were getting a bit bigger and that they were achy. And she had crackles. She said that she was just a little more tired than usual, and she has shortness of breath. Next are our nursing interventions. So our first one is auscultate breath sounds. We're going to maintain fluid and sodium restriction as indicated. We're going to monitor her daily weights. We're going to administer furosemide as ordered, and we're going to monitor her vital signs. And these are our collaborative interventions. So we're going to consult a dietitian to meet the patient's nutritional needs. We're going to consult with the physician for the need of fluid restriction. And here are our goals. So the patient will maintain a blood pressure of less than 140/90. The patient will have stabilized the urine output as evidenced by urine output greater than or equal to 30 milliliters per hour. And the patient will have clear lung sounds as evidenced by absence of pulmonary crackles. I will now give this stage to Detective Hak.
One. Hi, I'm Detective Hak. I'm still working on Mrs. Yates' case. So the second diagnosis is decreased cardiac output. Here's subjective and objective data. So she's still fatigued due to poor perfusion. She has a shortness of breath due to increase in oxygen demand. Her blood pressure is 140/70. She still has edema in both lower extremities. So as nurses, we're going to monitor her vital signs. We're going to encourage her to rest. We're going to assess her heart rate, palpitations, heart rhythms. We're going to check her calf tenderness, diminished pedal pulses, modeling or pallor of skin. We're going to encourage her to exercise as tolerated, and we're going to instruct the patient to restrict high sodium diet and fluid intake as indicated. Moving on, we're going to consult with cardiologist for monitoring 24-hour EKG rhythm and blood pressure. We're going to consult with dietitians to discuss heart-healthy diet and fluid intake restriction with the patient. And also patient's primary care manager or PCM will review her lab results and determine the plan of care. Moving on, last but not least, patient will adhere to the medication regimen, which includes anticoagulants, vasodilators, statin to treat her underlying diseases. Patient will maintain her heart rate between 60 to 100 beats per minute. She will maintain her balanced intake and output, and she will also monitor her daily weights. She will avoid high oxygen demanding exercises during the hospital stay, and when she discharges, she will maintain her own pace.
Hi, I'm Detective Chih, and my nursing diagnosis for the patient is activity intolerance. And here are some objective and subjective findings. The patient has elevated blood pressure, fatigue, shortness of breath due to increased oxygen demand, difficulty to engage in activities. And here's the nursing interventions. We will monitor for her skin integrity, instruct patient to get out of the bed slowly to prevent orthostatic hypotension. Also encourage patient to perform range of motion exercise as tolerated. And we will encourage her to rest. At the same time, we will try to assess for constipation. Next, we will consult dietitian to meet patient's nutritional needs. And we will consult with a physical therapist and occupational therapist to work on the ambulation with edematous feet. Last, our goals for the patient will verbalize understanding of the importance of using walking device if she feels difficulty walking on her own. The patient will verbalize importance of continued physical exercise. Patient will demonstrate energy management techniques. Next, we'll give the mic to Detective Genesis.
Hello, I'm Detective Genesis, and I will be presenting the last nursing diagnosis, which is knowledge deficiency. We're starting off with the objectives. Patient is not weighing herself daily and only obtains weights from the nurse. Recurrent admissions within 2 months. Did not notice signs and symptoms of CHF. The nursing interventions are educate the patient on early signs and symptoms of CHF and fluid overload, assess barriers to learning, identify cultural influences regarding healthcare, and educating the patient to report to the provider any signs of CHF and fluid overload. Next are the collaborative interventions. Consult with physical therapist and occupational therapist to rebuild the muscle strength. Consult with social worker to discuss about future home health visits, and consult with a dietitian to change her diet to heart healthy meals. And lastly, the goals. Patient will verbalize understanding of medication regimen. Patient will verbalize understanding of different signs and symptoms of CHF by discharge. And patient will create a weight log to track weight changes daily. Okay, and that concludes our presentation. I hope you guys enjoyed it. Now it's time for questions.